Thanks, Megan. So good evening, everyone. My name is Angela Gasbarre. I am a registered dietitian working for Con Edison in New York City as the wellness coordinator. Today, I'm going to discuss the role of the registered dietitian in a corporate wellness setting. So first, I'm going to talk a little bit about myself, what led me to my work in the corporate wellness field. Then we'll talk about the importance of employee health and why we want to promote wellness in the workplace. Next, we'll dive into common and uncommon roles of an RD in promoting employee health. We'll quickly touch on some challenges that are often faced when working to improve employee health. And lastly, we'll talk about the many opportunities that lay ahead in workplace wellness world. The learning objectives today are as follows. Understand the context and various goals of corporate wellness programs. Examine the role that a registered dietitian can play within a corporate wellness setting, and explore diverse areas of wellness that a registered dietitian can use their skills to improve the health and quality of life of an employee population. Okay, so first, a little bit about me and my path to corporate wellness. I received my undergrad in nutritional sciences from Penn State University. I then went on to complete my dietetic internship through Aramark's distance program in Bel Air, Maryland. After completing my internship and passing the registration exam, I knew I wanted to get my master's degree, but wanted some work experience, cash flow, things like that first. So I accepted a position in Jamaica, Queens at Silvercrest Center for Nursing and Rehabilitation. There I worked as a clinical dietitian on the subacute rehab and long-term care unit floors, eventually moving up to the more critical care floors. They had a long-term ventilator weaning rehab floor. So after working with the more critical care patients, which I loved, I began to realize that the growth and opportunities within clinical nutrition were not something that I really saw myself doing. So I began to explore my options and decided working in some sort of community setting would be ideal for me. So with that, I decided to get my master's in public health and was accepted into the public health program with a focus on nutrition at New York University. At that point, I began sort of talking to my RD friends, all my friends, spreading the word that I was going to be looking for another job, and I found an opening for a corporate wellness dietitian at Con Edison. I was hired, and because I was going to school for public health, the department knew that my skill set could be utilized in other areas of health for the company. I was first hired as a contractor for the department, then brought on as a company employee in the registered dietitian role, and then later promoted to wellness coordinator, managing a team of myself and 2 other contractor dietitians. So I tell this long story about the path to corporate wellness for a couple of reasons. One being that when I started working as a dietitian in 2013, career paths outside of clinical or government-funded community roles weren't that well known to me. So I think it's important to hear how accessible these unconventional roles are. Second, I want to demonstrate that having focus, maybe not necessarily on exactly what you want to do, but more of a focus on the direction you want your life to go, or an idea of work or career that looks good for you, that it's important to just stay focused on that path. And lastly, because as you will see throughout this presentation, corporate wellness has a public health lean to it as opposed to a clinical feel. So let's set some context here. Registered dietitians are experts in helping fight obesity in the US. So we're going to look at how obesity has increased in the US from 2011 to 2019. The more green and yellow you see, the less obesity. The more orange and red you see, the more obesity is prevalent. Starting in 2011, the average rate in the US for obesity was 35.1%, with another about third being overweight. So as we go along with a few of these slides, we'll see how the map colors change. So they're getting more orange. We're seeing more and more orange, deeper red. And as we move along, I mean, now we're really seeing a lot of orange, more red. There we go. There we got the reds. Yeah, and we're to 2019. So here's the latest data from 2019. No state at this point is less than 20%, with Colorado being the lowest at 23.8%. The average rate of obesity overall is 42%, way up from 8 years ago when it was 35.1. As the rates increase, so do our chronic diseases, leading to an increase in healthcare costs and need to address obesity and other chronic diseases. So now let's talk about the importance of employee health and healthcare costs. It is very likely that a company's main goal for implementing and maintaining a wellness program is to reduce healthcare costs. The data on this slide is from 2019, when the healthcare costs in the US was 3.8 trillion, or about $11,500 per person. So who pays all this money? Some can be covered from Medicare, Medicaid, but working adults are likely having to cover this cost partly by themselves and partly it's on the employer. So in 2019, the average cost to the employer to provide health insurance for a single employee was, $5,711 and a little over $14,000 for family coverage. This is a major increase, as you can see, from 2009, when the cost was, a little over 2,000 to, 4,700 respectively for an individual and families. So healthcare costs in the U.S. is twice the average healthcare cost of other developed countries. So it's no surprise that a major goal for so many companies, agencies, government programs, things like that, is to reduce healthcare costs. So let's talk about drivers of healthcare costs, right? In the wellness world, we think about reducing healthcare cost spending by preventing or managing chronic illness. I include this slide because I want to show that so much of the spending comes from other factors that are outside a registered dietitian's control. So as not to get discouraged if this goal feels very lofty, if it's ever part of a company that you end up working for and you feel it's difficult to deliver, you'll have some more information to go with that. So let's take a minute to go through these quickly. The first one is the number of people. So that $3.8 trillion in healthcare spending that the US makes may look inflated in relation to other countries because of our population. We have a large population, so we can't really do anything about that. But that's one of the drivers of healthcare costs. So the second is our aging population, which is due, to medical advances, improved standards of living, and other things, which again, not much we can do there. We can look at that as a positive thing. The third component to things that affect healthcare costs is disease prevalence and incidence. So this is an area that we could have an impact on, right? Decreasing or managing chronic illness. And we'll go into that a little bit more in detail on the next slide. The fourth driver of healthcare costs is how often people use care and services, which can be looked at as a good and bad thing. It's good that people are utilizing services and that we have services for people and medical advances for people. But bad that we need to use so many resources and healthcare, right? And lastly, increases in the price and intensity of services. I've been in many meetings that sort of discuss this, that this is a major driver, the cost of the actual services that people are seeking, which is kind of a mess that I don't really want to get into, but it's something that we as healthcare professionals, we can't change that. We have to be aware that that can be a big driver of cost. So with many of the factors that affect healthcare costs being out of our control, it's important to look at other aspects of employee health and what other areas dietitians can have an impact on, especially those less daunting than healthcare costs. So as I mentioned, I wanted to go into disease prevalence as drivers of costs. So what are the main disease drivers of healthcare costs? You see, the first is actually heart disease and stroke, which costs $214 billion per year and causes $138 billion in lost productivity on the job. Cancer is another big A big driver of cost, it continues to rise and it is expected to reach almost 174 billion by 2020. As I mentioned, these are from 2019, these stats. These numbers are just telling me that we do have better care, better screening, but that does, also come at a higher cost. The third biggest driver is diabetes. In 2017, the total estimated cost of diagnosed diabetes was 327 billion in medical costs and lost productivity. And lastly, obesity, putting people at risk for these chronic diseases such as diabetes, heart disease, and some cancers, cost US about $147 billion a year. So here we are. We know so many other factors play into the cost of healthcare in our country, but that as RDs, we can make some impact on increasing the costliest conditions with our knowledge and skills. So why workplace wellness? Well, why workplace wellness is because we spend about a third of our lives working, and half the hours in each day, most days, are spent working. This workplace wellness industry is an $8 billion industry. I'll tell you, for me personally, as I began my work in public health, corporate wellness was appealing because it was like I had a captive audience. Reaching employees can, always be difficult, but community outreach and, the fact that employees had to come to my place of work because it was also theirs made me feel like I was able to connect with them and maybe make the workplace wellness, more worthwhile, improve their health behaviors. So let's look at the popularity of wellness programs and think about how they work. So this first study that we're going to go through, the Measurable Benefits Wellness Program in Canada, in 2018, wanted to look at the participation rates of a new wellness program. So the new program included 3 areas: completing a health risk assessment, looking at both physical and mental health, attending online education modules, and participating in challenges that focused on increasing physical activity. So I really want to go through sort of the participation rates here. 94% of employees signed up to participate in this program. 78% completed the baseline biometric screen, which is, a large percentage, with slightly less completing the mental health assessment. 79% followed up for their second biometric screen, which is great. That way you have, baseline and see how those biometrics changed. So after 1 year of the program, they found improvements in blood pressure, the total cholesterol, HDL ratio, weekly physical activity, perceived stress, sleep fatigue, and the 10-year cardiovascular risk. There was also a small increase in weight without an increase in weight circumference, which just sort of tells me that increase in weight could be muscle, but basically not a big impact on weight there. So we have a program that employees were interested in with some improvements in health status, but that's just one study. So let's look at another. So next study, effects of a workplace wellness program on employee health benefits and medical use, was a randomized control trial on employees working for a university in Illinois. As you can see, there was a large sample size with 3,300 employees in the intervention group. Measurements were taken at baseline, 12 months, and 24 months. So we were able to measure more long-term effects of the program versus the previous study done in Canada. They looked at health beliefs of the employees, self-reported health behaviors, and their biometrics. So their finding, while there was no significant change in biometrics, they did find a significant improvement in employees' beliefs about their own health and an increased proportion of employees reporting that they had a primary care physician. With that, what that tells me is that they are more conscious of their health. They're, putting it more on their radar. And what these 2 studies tell me is that While it may be hard for employers to reduce healthcare costs just by an employee wellness program, we can change their health beliefs, bring awareness to their health, and maybe make a small impact further down the line for these individuals. So as we're dietitians, we're always looking to improve numbers, lab work, weight, the number of fruits and vegetables eaten. But I want to take a moment to look at productivity as another possible outcome to improving employees' wellness. Mental health issues are also a major contributor to healthcare costs. That wasn't really covered as one of the big ones, but it definitely is a driver. And these impacts can be seen in other ways, such as productivity. One of the focus areas when measuring employee health is productivity. In general, a healthy employee is an efficient and productive employee. Some ways to measure productivity is absenteeism and presenteeism. So absenteeism is defined as being away from work due to absence or disability. Absenteeism costs employers about $225 billion annually. A slightly newer term in the world of employee productivity is presenteeism, which is defined as being present at work but constrained in certain aspects of the job performance. Think distracted, multitasking, personal matters, maybe due to health problems. So if you look at the graphic to the right, you'll see that this can look like making mistakes, being distracted, as I mentioned, or taking longer to complete a task than usual. We can also think of this as burnout as well. So this leads you to wonder, how can we prevent presenteeism? All this to say that, that the healthier the employees are, the more productive they will be at work. Not only is that a good thing for the employer, but when you think about that from a health or quality of life perspective for the employee, if you're able to focus and be productive at work, then you'll be less stressed and able to manage their work better. Another aspect that's related to productivity is employee retention. This makes me think of, newer companies versus older ones. Newer companies might have things in place to help keep employees, understanding that employee retention is very important. According to the Business Dictionary, employee retention refers to an effort by a business to maintain a working environment which supports current staff in remaining in the company. So this is important because the cost of voluntary turnover is not cheap for employers. Most estimates put the cost at about 6 to 9 months of the employee's salary. So if you think about the employee may only be there, maybe 2 years if they're facing this burnout and something like presenteeism, and the cost of the resources put into hiring and training a new employee is a big chunk of that employee's salary. So it's in the company's best interest to care about its employees, and one way to do that is to provide them with the support they need to essentially live their healthiest lives. Putting resources into making employees feel cared for, improve their health, and lead to a better quality of life should also be a goal, not just cutting healthcare costs. It's a financially smart goal to have happy, healthy employees, even if healthcare costs are on the rise. So with that, let's see what us as dietitians can do to improve employee health and be an asset to the company. Of course, there's our lovely Megan in this great photo. But our first common role of an RD in the workplace is to conduct nutrition counseling. As we know, RDs are the credentialed nutrition specialists most qualified to do this. And having this benefit in the workplace is so important because being a dietitian can be super difficult for somebody to access, either because of physical distance, the cost of their healthcare plan doesn't cover it, or they just don't have the time outside of work and family obligations to do it. The structure of nutrition counseling within the company can depend greatly on the company. At Con Edison, we have RDs on staff, but this can also be done through a third-party vendor. Considerations of nutrition counseling in the workplace include, is it a homegrown program where RDs are just a part of the employee population and, it's part of their job description, they're paid through the company, or are these services billed out to an employee's insurance? That's definitely a consideration to take. Will the employee be allowed to see the dietitian on company time, or will it be on their own time? Again, making this service as accessible to the employees, the better. But depending on the employer, it might not be possible to do on company time. So, making that adjustment to benefit the company and also have that resource for employees. And also, there will very likely be a lack of past medical history, which to me can be a positive thing when doing this kind of counseling, right? So in a clinical setting, we counsel people after they receive the diagnosis or they're referred to us from their doctor as they're being treated for a diagnosis. This can be the case in a workplace wellness setting, but we might not know it. An employee might be recently diagnosed and they find out about the benefit, within their company, and that's what allows them to seek, our guidance. But in the case of workplace wellness, this allows for employee-guided counseling sessions, which I'll tell you I've enjoyed more so than my previous, clinical setting personally. The employees come to us, let us know what areas they're struggling with. Of course, we ask for medication and medical history, and they're going to let you know if there's anything critical going on. But chronic conditions may not be what they want to focus on. And for me, that's okay. Employees come to us with questions with a goal in mind. For example, how to cook more at home than ordering out, or maybe how to have more energy. And we can counsel them on what they're ready to discuss. And if we get them to maybe cook more at home meals as opposed to ordering out, we can still have an impact on those chronic conditions that they may have, but they don't want to disclose to us. And I feel like in the workplace wellness field, we can be that advocate for health for employees by listening to what they want and what they need. So another role that RDs can fulfill in a corporate wellness setting is nutrition-focused presentations. These can be done at department meetings, be a standalone event like a lunch and learn, or be part of wellness program incentives. The fun part about presentations for me is coming up with the topic that speaks to your audience. We know nutrition recommendations are not a one-size-fits-all science, so coming up with a topic can really get your creative juices going. The first thing to always remember when creating presentations for the workplace is to organize the information in familiar terms. So 2 examples that I have here that I've created. The first one is a healthy to-do list, which I use to kick off meetings at the beginning of the year, that touched on various aspects of health, but it was in sort of a checklist form. Pay attention to your eating, move more, stress less, sleep well, different things like that. So making it something of a checklist. And for the presentation on the right, how to make comfort meals healthier, I gave ideas for healthy swaps on popular food. On the side, you'll see, General Tso's, how to make that a little bit healthier, or chicken parm hero, which is a very popular food item with my employee population. So just making those small changes and showing them that they can still have the foods they like while also making them healthier. So another component to consider for workplace wellness is how work fits into employees' lives outside. For the presentation on the left, sleeping and eating through shift work, I created an example schedule for employees who may be doing shift work, maybe overnight, and have a hard time organizing their 24 hours between eating, sleeping, work, their personal life, into what's considered a typical 24 hours. With all that going on in their lives, they weren't able to visualize, when am I supposed to eat? What am I supposed to eat? So sort of laying it out for them can be super helpful. On the right side, I created a presentation how to incorporate vegetables and plant-based proteins in your child's diet. I did this for a mom's group lunch and learn presentation, and included examples of how to get kids engaged with their meals and build a healthy relationship with food. A really great presentation and a helpful lunch and learn for moms at our company who are balancing working and also worrying about their children, making sure that they're getting the nutrition they need. What an amazing benefit to employees to have this resources on hand at work while they are thinking about their families, and now they're able to take home that advice to their families. And my last example of presentations that I've done for an employee population is some graphics that I use to explain a lot of scientific information, right? So understanding the science behind the recommendations is important to help people with changing their behaviors, right? I know for me personally, I have to understand what I'm doing and why I'm doing it before it really clicks to actually do it. So the first presentation on the left, Eating for Energy, is explaining the insulin response of various foods and also putting those foods into categories, for the macronutrients. Those, carbohydrates, protein, and fat employees are familiar with. So laying out those categories for them. And the second presentation on the right for heart health, I provided a visual on risk factors. You won't see it in this presentation, but the circles kind of popped up and the stars popped up as I went through the table. So those that are circled are their modifiable risk factors, and the stars were the ones that we were going to focus on either directly or indirectly during the presentation, helping employees to understand what they can change and some things that are out of their control. Another role that dietitians can play in the workplace is creating and promoting wellness challenges. This is typically, I see this typically done through a third-party vendor, or the RD can develop these, definitely on their own. So the RD can do this, on their own, or they can be employed by the vendor, or they can be employed by the employer and manage the program with the vendor. So there's definitely different ways to do that. Some common wellness challenges for some common wellness challenge companies include the Mayo Clinic, which has a great program, Virgin Pulse, which is a very large company that manages, a lot of wellness challenges, as well as helping with benefits, incentives, and things like that. Vitality and Wellness Corporate Solutions. So as I mentioned, these companies often do more than just challenges. They can add to the company's comprehensive healthcare benefits program. So the exciting thing about corporate wellness challenges is how much broader that definition has become. We'll talk more about that a little bit later, but one area you can see that is the challenges. So challenges can be run at whatever time interval desired, whether it's annual challenges, monthly, daily, sort of whatever. Employees get really excited about challenges, I'll tell you. I think it makes health behavior change feel attainable. Okay, I have this time frame, I have to do these things. They're pretty easy to understand, and they can follow it at least for the challenge duration. So some examples of common challenges are the 10,000 steps challenges. I'll tell you this is the most common and the most recognizable to employees. At Con Ed, we had done it before I had worked there. And as I was promoting other challenges within the company, they would always say, oh, the 10,000 steps challenge. 5 years later, they kind of, even if we were doing other things, always recognizing the 10,000 steps challenge. Another challenge could be planning your meals daily. That's a good way to link in with the dietitians. Or maybe it's connecting with coworkers outside of work conversations every month to reduce the feeling of isolation. This is a big one now, especially when we're still working remote or, a hybrid sort of model and practicing social distancing, right? Making it a goal for people to connect with others in other ways. Or maybe it's reducing screen time. This has been a big one lately, especially with the emphasis on getting sufficient and quality sleep. So those are some examples of how wellness challenges have come outside of just the 10,000 steps and eat healthy. It definitely takes in more of the total body wellness and mental health. So to round out this section of the RD's role in promoting employee health, I want to talk about some uncommon rules or just rules that you might not have thought of an RD doing. So my main reason for including this slide is that I want dietitians to know their worth and realize that your knowledge base and skill set is so good. And I want you to be sure that you know to promote yourself however you want to, because we can help people. And we can do that in so many ways and be a real asset to a company outside of just nutrition, right? So some other rules could pertain to state or local policies, one being the requirement to provide safe, private, and clean areas for women to express breast milk. A company may need somebody to manage those spaces, orient the women to that space, and provide the education that's needed. And we can understand the importance of a woman who wants to return to work and continue to provide breast milk for their child. So who better to sort of manage that program or manage those rooms than a dietitian? Another area that is big working for a utilities company is safety. I work with employees who have sleep apnea, and because the department recognizes that dietitians have the sensitivity training when discussing chronic health conditions and can also help employees with those behavior change techniques if they're looking to do so, right? There is a link between safety and health, and if you think about it, employees struggling with highs and lows in blood sugar or lack of sleep may not be as focused or more likely to make mistakes. So the data is there, and there are real ways the RDs can have an impact on fostering a safer and healthier workforce. Lastly, another role we can play is in HR benefits. We know the importance of health and maintaining a healthy employee population, and I've seen it in meetings. It's super beneficial if you're in HR benefits and working on, what health insurance you can provide for your employees. It's great to have somebody that knows the chronic illnesses that affect the workforce on what I like to think of as a personal level. Even though we may not be struggling with those chronic illnesses, our training gives us the understanding of what a person needs to help themselves, what medications they may be on, and services required. So having a health professional and an RD in the room can help whenever making those decisions on health benefits. So of course, we have to talk about the challenges that health professionals often face in a workplace wellness environment. So first is budget, of course, always. Having enough money and resources to run the programs can be difficult, especially when we often don't see an immediate return on investment. My counter to that is that, as we mentioned on a previous slide, sell it. We know the importance, and sometimes we just have to find that angle. Maybe it's not concrete numbers like healthcare spending of employees. Maybe it's more employee satisfaction with their job or feeling like their employer cares about them, which can lead to a return on investment by employer retention rate, right? So it's just framing the benefit, the cost benefit of having, an extensive employee wellness program or an RD on staff. Second is employee trust. Personally, for me, I always keep work and personal life pretty separate, so I can understand that it can be uncomfortable to share personal information in the workplace. And employees may feel like you're going to share their medical information. I don't know with who or what possible conspiracy theories they think, but I hear that often, like, I don't know what you're going to do with this information. And my reply is, we're going to help you. We're not going to do anything with the information, but try to get you, help and services or information that you need. And for that, again, this is an aspect of rapport that is very important to build with employees you're serving, either from, the workforce, the bottom up, to the top of the leadership or the leadership chain down. Building that rapport, letting employees at all levels know that you're an advocate for them and that you're not looking to sort of catch them or share their information in any way. The third challenge is communication, especially with communicating these programs to employees and sort of hitting them whenever it's their time to listen, right? My best advice for this is to be people facing. Sending an email can be one thing, constant sort of word information about the services. But if you attend a meeting and the employees know what you look like, this can help build rapport and help employees hear the communication you're sending them if they see your face and know who they're contacting if they do decide to participate or engage with the program. And lastly, hitting on all the needs of the employees. I will say at times it feels like what we do is not enough to help employees. Oftentimes they have so much going on outside of work that they need and so much that they have to do to get their health back on track that it feels like we can't do anything. For that, I say keep the faith. We know that if people can take even a small part of what we say home with them, that we've done our jobs. We're better having been there than not. So keep the faith when doing health promotion work. So here I want to talk about opportunity areas that I see for RDs that they can have an impact on in the workplace. First, like we talked about, there are different avenues for employment for RDs in the workplace, either to be employed by the employer, to be a contractor to the company, to work with a wellness vendor for a company, as mentioned previously. So there's lots of areas for opportunity there. And if you're not finding that employment opportunity, maybe you could create one, sort of develop your own wellness program and pitch it to companies. Second is, employees' families. So this is becoming, a bigger trend with employee wellness, reducing employee stress and increasing focus while at work. As we mentioned, think about productivity, absenteeism, presenteeism. Some services can be extended to family members and include maybe childcare, adult care, wellness incentives. We'll talk a little bit about wellness incentives on the next slide, but maybe they could be extended to family. The services like nutrition counseling could be extended to family members. A lot of the stress that employees have in their personal life can maybe not be with their health, but health of a loved one. So extending those services to employees' families is a huge area of opportunity. Third is employee environment. So RDs can work to provide healthy meal options on the job site. We could work with, healthy restaurants or delivery services, maybe making a discount for the employee population you're serving. Maybe it's working to designate a safe area for physical activity on the job site. Now employees are working from home so much, RDs can also be a contact for employees to work on their home office environment, how to make it more conducive to their health. Maybe I've done a lot of discussions on setting boundaries for work from home, structuring meal times maybe differently, but giving people that guidance of how to make their home life a bit healthier now that we're always home. And the last point that we definitely have opportunities in is inclusivity. From a public health perspective, with our fundamental counseling skills, we recognize that the needs of women, men, those undefined to young, old, and different education levels are all different, unique, and we can use our skills to reach that diverse workforce. I have found this key, of course, with a large company that I work for in New York City, but anywhere people want to feel seen, and if we can view employee health as a unique need for each employee, the employee can feel seen and more likely to engage in the programs that are provided for them. This also makes me think of access I had mentioned before, nutrition counseling, where nutrition services may be out of reach for certain populations, and our presence in the workplace can be such a huge benefit and gap filled for them within their health journey. All right, so to wrap things up, a couple points I want to discuss for the makings of a well-run wellness program. First, I know that autonomy and quality of life is important to employees. In corporate wellness, everything is always voluntary, and you want employees to feel like it's them making the decision to participate and improve their quality of life, however they see fit. this can be done with nutrition counseling, a robust health benefits program, an environment that promotes health with, making the healthy choice the easy choice, as I talked about, making the or the work environment healthier, and incentivizing health behaviors. So incentives. I didn't touch on incentives a ton throughout this presentation because, to be honest, there's just a lot to cover. But much of the evidence shows that incentives don't carry a ton of weight when changing employees' behaviors. That being said, they are a part of wellness programs. For completing components of a wellness program, incentives can look like things like giveaways, like a water bottle, maybe a small amount of money in each paycheck, or maybe it's money toward another health promoting activity like attending the gym, or even money toward at-home exercise equipment. Another incentive could be paid time for health activities. I've heard of companies that allow extended lunch breaks if the employee is using it to be physically active during that time. So incentives can take many shapes and forms, and are often, there's multiple incentives within one program, but this is something that should really be tailored to the size of the company, the demographic of your workforce, but it's definitely something that has to be, applied to the wellness program. And lastly, upsell. I mentioned this in previous slides, but I want to upsell the upselling. Upsell your knowledge base and skill set as a registered dietitian. We know that a person's health is not just what they eat. So designing the program and education materials to reflect that is going to make the program more robust and applicable to more employees. So finally, any questions for me? And I put my contact, I just have an email, but I'm happy to answer any questions that you may have offline if you think of them later, or, just have any lingering thoughts about corporate wellness and the dietitian role.
All right, thank you, Angela. So we do have a few questions that came through. So the first is, what's your take on challenges like Biggest Losers or weight loss challenges among workers? These are usually monetary incentive based. So yeah, I've heard of that too. A lot of times companies will give a monetary incentive for that type of program.
Yeah, so we've been working to reframe these challenges to sort of avoid the rapid weight loss. I'll tell you one thing. It's hard with employees because we need things to be familiar to them. And the Biggest Loser, that's just a very familiar term, so it kind of works. But our way of circumventing that is providing essentially a maintenance portion to the program. So it could be branded as the Biggest Loser for the department purposes, but for the RD purposes, we have, we make the program extensive. We do education, on a weekly basis, and sort of monitoring the weight and promoting sustainable weight change, and not entertaining really any of those rapid weight loss strategies, and sort of just selling that rapid weight loss sort of mentality.
All right, great. Another question we had is your master's in public health. How do you think that prepared you differently than, say, a clinical master's program?
Yeah, so my public health, it gave me some perspective on what the general population's needs are. Through NYU's public health program, we had to do a couple community assessments where we go into different communities and sort of look at their environment, look at the programs available, and look at the, the health conditions as a whole, the percentage of people that have those conditions. So you kind of do the same thing with workplace wellness. You're not looking at individuals, you're looking at groups of people and how they're interacting with each other and how they're interacting with their environment. So and took me out of the just thinking of the individual and their labs and their, their medications, and really looking at the environment in which they're interacting with, and considering that, as well as all the clinical pieces of it that we do as RDs have a knowledge base for.
Great. We had another question that came through. How do you engage your employees? What are your main, is it kind of just they know you so they come to you, or do you have specific strategies behind that?
Yeah, so we do a lot of promotion at different levels. Senior leadership is one that you always want to be sure you have on board and are aware of the programs. It sounds obvious. It sounds like senior leadership would be maybe making sure that there's a corporate wellness program, but that's not always the case. So you definitely want to make sure there's senior leadership buy-in, because what they can do is let their sort of subordinates know, hey, promote this to your employees, and they let their subordinates know, promote this to your employees. So one of the main strategies is always, being top down. So whenever we have a new program or new aspect of our program, making sure senior leadership is also aware of that. And then, we do communications locally at different sites. So, some sites might do a lot of paper signage, some sites might do digital signage. So, getting those local site communications out. And then again, it's kind of just the hustle of getting around to the meetings. And what I mean by that now is Zoom meetings. But, getting your face out there, putting your face wherever it can be, to put a face to the program. That's one of the most valuable strategies that I've learned.
Awesome. Okay, we have another question. Are you able to provide any guidance on contracts? For example, a 3-month program that you're pitching to a company, or a lunch and learn twice a week for an hourly rate. How does that typically work? I know like Con Ed employs you, but if you have any insight as to how that process might typically work, since you do employ contractors.
Yeah, so I can't speak to numbers, but I can speak to somebody that might be on the receiving end of contracts. Being prepared to have alternatives, right? Because when you're coming to a company and you want to sort of sell your product, essentially, your program to the company, it's good to have flexibility with your structure, because you may think the employee population, but you may not. So being able to be flexible within your contracts to allow the company to guide what the employees need, I think that would be really important for pitching the contracts to employers.
Yeah, and that kind of leads to the next question. I'm interested in being more of a contract worker, providing programs to companies. Is this something that's done, or is it typically that an RD is an employee? And I think based on your presentation, the answer is both, but any insight there?
Yeah, I mean, honestly, I would say the majority of what I see is contractors going into companies. Even whenever I'm just meeting new friends or talking to people, and they tell me about the company that they work for, it's always like, oh, our stuff is provided by this company, right? When I'm like, I'm an RD and I do this for this company, it's like, oh, our company has, and then they name a company. So I actually think it's more common to have contractors go into companies to provide their wellness program, as opposed to being in-house.
Great. Yeah, and I think that's kind of what I'm seeing more often, and I was kind of wondering, in a clinical setting, is this a situation that you might see like a hospital would also employ something like this? Like, are these, I guess, what types of companies are seeking these services, and do you think that's changing as healthcare costs and all these things are rising?
Yeah, so you are just seeing it more and more. It's almost rare for a company to not have a wellness program. And you even mentioned a clinical setting, and they are really, I mean, healthcare workers are just worked to the bone. So health, wellness programs within even hospital settings for healthcare workers are even more important. But you see a lot of the newer cutting edge companies almost always have, this kind of benefit for employees, but you're seeing it more and more all around that, pretty much every company has some form of a wellness program. And I would say, if anything, it'd be a little bit older companies that they're not quite as robust. It's like part of their, insurance benefits, where I think that's where we can kind of dig in and be like, okay, they have that, but you need something more robust within the company. And I think that's becoming more prevalent, but I think that's an area of opportunity for, smaller, maybe older companies.
Yeah. Okay. And we have a lot of questions around pricing and how to approach these issues. And I know you can't speak to numbers specifically, but that being said, how to structure, what you're charging. And let me know if you agree with this, but when I approach contract work, or I'm approached at it, I'll generally look down at the breakdown in per hour of, what the service is and kind of what it would cost an hour of our times. A lot of us have master's degrees, and you have to advocate for yourself and you have to charge a fair price, but I think you also need to give them a number that's going to be reasonable to the contractor. So, consider all the activities you're putting into it and then come up with a price and kind of see. And I like to ask other RDs, but Angela, I don't know how you have approached that in the past, and without being specific about numbers.
Right. I mean, what you said is right. Like, think about how much time it's going to take for you to develop the program, make the materials per se. You have to account for the time that if you send out emails or communications, you get communications back. So you have to account for that time. I think another thing that's important to consider when pitching, your price or whatever to a company is the amount of employees that it's going to reach. Right. So if it's a large company, your price could be higher. If it's a smaller company, they might not pay that much per employee. So think about that. It could look too costly for the amount of employees that they actually have. So thinking about that, thinking about what you expect the participation rate to be, right? So a company has 2,000 employees, but participation rates usually like about 15, 20% maybe. So, thinking about that is something that a company might come back to you and say, like, oh, well, I have this many employees, but only this many are likely to participate, So being ready to address that, I think is a good way to strategize your pricing too.
Yeah, that's great advice. All right, I think that was all of the questions. Again, everyone, you will be receiving a follow-up email from me with with Angela's contact information, as she shared on the slide, the reference list for this presentation, and I'll be sending your certificates of participation. The recording of this will be on the Dr. Shar Institute website in the experts area. You will need to have a login to access that. It usually takes a few weeks or so until the Academy approves that I can post the recorded version. But thank you so much, Angela. This was great, and I think really different for our audience. So I'm so excited we got to have you on.
Awesome. Thank you for having me. It was great.
All right. Thanks, everyone. Be on the lookout for an email from me.